Thank you. It's always funny when someone introduces you and you think, is that me? Is that me she's talking about? Um, anyway, thank you very much for that, Caroline. And thank you for inviting me to France. You've had a lot of faith in this workshop, um, throughout the pandemic. So thank you very much. And I'm coming. So it's really happening. Um, Today, I wanted to give you a mini lesson about Ontake, so that you can go away with something useful and you can ask me questions afterwards. And so I'm going to do some slides and also play some video. And anything that you don't understand, just let Caroline know and she can translate. So let's start off. I think I'll go to another screen myself, which means that I can't see you guys anymore, but it means I can concentrate on my slides. What I'd like to do is introduce Ontake to you right away. You may have seen my videos, or perhaps you have not. So I'm going to show a quick 30-second video about Ontake. Fill a piece of bamboo with Moxa wool. Pack it firmly. Compress it. Light it. And tap the warm end lightly, rhythmically on the skin. Okay, so that's Ontake in a nutshell. It's a moxibustion device, and we can light it and apply the lighted end to the skin, or we can roll with the side of the bamboo, or we can press with the lip. Let me get one. I should have prepared this before the show. Right, so it has different edges, different surfaces that we can use, and we can apply it very lightly, or we can apply it quite percussively, or we can press very deeply, or we can roll very lightly. So it's a very versatile tool that can be applied at different levels. Now, traditionally in Japan, it's been used just as a branch tool. In other words, if someone's got shoulder pain, then it was applied on the shoulder. So that's how it's been used traditionally. And when I say traditionally, I mean just maybe for the last 40 or 50 years, because Ontake is a baby in the timeline of acupuncture. Ontake is really a new arrival. There's no record of it in the classics. There's no record of it really until the 1960s. So it's a very new kind of thing in terms of acupuncture. And I feel that in the last 10 years, its use has kind of mushroomed, not just with the work that I've done, but also other people, for example, Philippe Caudet in France and Shinma Sensei in Japan, who've used it in all sorts of different ways to how it had been used. One of the ways that I won't talk about today, but I'm teaching, is to integrate it with something called Dr. Manaka's meridian frequencies, which is applying it with rhythmically with a metronome at specific beats of beats per minute. But what I want to talk to you today is two ways to apply it in a very structural way to treat sore throat and to treat sacral pain. So I'm going to talk to you about both of those things. Let me just come back to the room and see how you guys are doing. Everything okay there? Yeah. All right. You can hear me and you can see everything. All right. So to understand how to treat sore throat, we need to revisit yin and yang. And if you think about yin and yang in anatomy, then heaven is up here, the top of the head, and earth is down by our feet. So there's a vertical line which is coming from top to bottom. And that vertical line, there's one vertical line that divides the body into two halves, left and right. And there's another vertical line that divides the body into two halves, front and back. And there's another vertical line that divides the body top from bottom, a horizontal line. And those in anatomy, we call them the sagittal, frontal, and transverse planes. But as you can see, this gives us 4 anterior quadrants. There's 4 quadrants on the front and 4 quadrants on the back. So 8 quadrants in all. This is actually something that Dr. Manaka, a very famous Japanese acupuncturist, developed, and he called it his octahedral model. But basically, it's just yin and yang. So the upper treats the lower, the upper quadrants treat the lower quadrants, and vice versa. And the front quadrants treat the back quadrants, and vice versa. And the left quadrants treat the right quadrants, and vice versa. So very simple principles of yin and yang. Left treats right, back treats front, upper treats lower, and vice versa. So then we want to think about the throat. Well, the throat, as you can guess, is superior and it's anterior. And usually it's on the midline, but sometimes it's worse on the left and sometimes it's it's mirroring. Sometimes it's worse on the right and sometimes it's worse on the left. So you need to find something that is opposite to superior, anterior, and left and right. And what we can say is that if we're going to go inferior, which is opposite to superior, and we're going to go posterior, which is opposite to superior, and on the midline, then that's going to bring us to the sacrum. So you can see that anatomically, the sacrum is opposite to the throat. Now, also, in terms of yin and yang, we can think about channel pairings. So we know, for example, lung is paired with large intestine. So we have these internal, external relationships. So let's think about the meridians that go through the throat. Well, the first obvious one is the renmai, which, as everyone knows, comes to here. So it comes up through the throat up to here. And then there's the kidney channel. The kidney channel comes to kidney 27, and then there's a deep pathway that goes up to the root of the tongue. So these channels are very important to consider when we treat sore throat. And if we think about the channels that pair with renmai and kidney, then we go straight to the back. And we can say that the dumai pairs with renmai and the bladder channel pairs with kidney. So now we have a structural model to understand how to treat sore throat. We have an area, which is the sacrum, and we also have 2 channels to treat, bladder and dumai. So let's see how that works. So make a note of those reactions, and those are what we're going to try. Hang on, let me. That's better. Treat. So we're just going to light our bamboo. And we want to make sure it's not too hot. So just tap against the palm of your hand and then against your wrist. If it's comfortable on your wrist, it should be comfortable on your patient. And we'll start by tapping lightly with the bamboo. And then you can get your patient to swallow and see whether there's been a change in the sensation of the sore throat. Then you can start to do rolling. Rolling is slightly deeper. So just rolling with the bamboo, working into the tissues of the sacrum. And once again, you can stop, you can get the patient to sit up and swallow again and see if there's been any change. You can also roll longitudinally along the line of the sacrum. Now, sometimes the sore throat will be more on one side than the other, and we want to treat the opposite side. So if the sore throat is on the left-hand side, you want to focus on the right-hand side of the sacrum. If the sore throat is on the right-hand side, you want to focus on the left-hand side of the sacrum. And if the sore throat is right in the middle, you focus more on the midline. So let's assume that someone has sore throat on the right. We would be rolling slightly more on the left here. And once again, check for reactions. If the pressure pain has changed, then you can finish. Right. That worked. I'm glad this technology works. So what can you expect to happen when you treat like this? The first thing to remember is that Ontake is, in this context, is used as a branch tool. So you want to integrate it with your normal acupuncture. So if you do TCM, then do your TCM treatment first, and then apply Ontake for 5 minutes at the end of your session. If you do Dr. Tan balancing, then you can apply Ontake for 5 minutes at the end. If you do Japanese acupuncture or Toyohari, you can apply Ontake for 5 minutes at the end. So it should dovetail into what you do. You don't have to change what you do in your daily practice at all. This is something you can add. Now, what can you expect to happen? In my experience of using this treatment, sore throat, if it's like 8 out of 10, really, really painful and inflamed, it will drop down to a 4 or a 3 within a few minutes, maybe 2 or 3 minutes of treatment. You just roll, check, roll, and then check again. If the sore throat is like a 4 out of 10, then you can expect it to disappear completely. But even if the sore throat doesn't disappear, it just diminishes within the 10 minutes of the treatment, you can expect within an hour or so that it will get much better. And I've had this happen many, many times. Once I was demonstrating in Japan, and there were about 50 students all gathered round, and it was a female patient, and she had sore throat. And I felt very reluctant to pull her trousers down in front of so many people. So I was rolling through her trousers, and she could feel the warmth through the cloth. And after 5 minutes, her sore throat went down from 6 to 4 or maybe 3. And I was a little bit disappointed because it was the first time that sore throat hadn't disappeared. But 15 minutes later, she came up to me and said, you know what, it's completely gone now. And I think it was because I was rolling through her trousers that the heat wasn't so strong. So the effect was more slow. Let me stop for a sec and see if there are any questions before I go to sacral pain. Whoops. Yeah. Who would like to ask some questions? Anyone? Anything in the chat? No, nothing in the chat.
I have a question.
Oh, okay, yes.
Well, could you just tell us why is it important? Like, why do you treat distal? Is it better than local?
I think there's a place for both, but I'd like you to think about a seesaw. Now, seesaw, when the fulcrum is in the middle, then, if you put a small child on one end and a small child on the other end, then the seesaw will be balanced. But if you move the fulcrum like this, then you need many children at this end in order to balance one child at this end. So when you treat distally, it's like using a lever like this. It's not even. So I think that I like to treat distally when there's pain and inflammation, because you can teach the body to, you have more leverage. That's my thinking. Nice question. Now, sometimes, as people who've learned moxibustion know, one of the contraindications for moxibustion is redness, heat, inflammation. So if someone has a very inflamed throat, it might not be the best treatment to do Ontake on the throat. Then you would consider doing needling. So that's another reason why you can consider distal treatment. Any other questions?
Yes, there's another question in the chat box. So why would you choose, upon what criteria would you choose to use the Ontake, rolling or tapping?
Okay. I think that's something that we'll cover much more in the course. There are some methods which are very light and superficial on the skin. So, for example, tapping, you're tapping with the lighted end like this, and you can tap very lightly. So all you're doing is warming up the tissue, the surface of the skin. But with rolling, you can roll very lightly like this, but you can also roll very deeply. So it depends what you feel when you palpate. So it just depends on the tissue findings as you're palpating. So your palpation is actually very important to funnel the kind of technique that you use. So that's a great question. Thank you. Any other questions, or shall I move on? I bet there's another question. I bet. Okay. All right. Let me go back to my software. Yeah. Now, we've just seen how we can use the sacrum to treat the throat area. So that means that we were talking about this idea of opposites. So actually, then it must be true that we can use this area to treat the sacrum. So I've given you a few examples, and I don't know if any of you have ever seen one of those vampire movies with Christopher Lee. Hang on, I'm out of the frame. Where he's kind of stabbed with a stake, like the vampire is stabbed with a wooden stake. So here we've got a representation of a human body, just this top circle. You've got the Renmai coming along the front, and you've got the Dumai coming along the bottom. And in the example we've been doing, we've been saying there's a relationship between the throat and the sacrum. And you can see I've drawn a long piece of bamboo going through the circle. So coming from here, from the top of the Renmai down to the sacrum. So I hope everyone can visualize that piece of bamboo as if I was a vampire and I'd been stabbed. So that bamboo is going all the way down to the sacrum. And so you can see that opposite relationship. Now, if you look at the second circle, the one in the bottom left, then there's another opposite relationship, which is between, say, Do14 and Ren 2. So again, the vampire has been stabbed differently this time. Now the bamboo is coming in the back of my neck and it's going through my body and it's coming out in my lower abdomen. So you can see there's another opposite relationship between the Renmai and the Dumai. So if you want to treat, for example, women with pubic symphysis pain, pregnant women, and they have pubic symphysis pain, the area to treat is around Do14, because again, it's opposite, it's posterior, superior, and the pain is inferior, anterior. And finally, when people have mid-back pain, then you can see that this time the bamboo comes directly through here, through Ren 12, and comes out around Do9, VG9. So you can see that there's a direct opposite between front and back, which is horizontal. And again, all the things that we talked about left and right being opposite also come into play. So I want to give you this model is basically the octahedral model in a very practical way, so that we can use these combinations. So now, if we have someone with sacral pain, then we could, I didn't press play. Let me try again. We may have a technical difficulty there. Yes. The first thing you want to do is start off with palpation. So particularly palpating on the sternum, looking for pressure pain reactions. So there might be some bruising or tight feeling in here. You can also look a little bit lateral, and there might be some tenderness coming out onto the kidney channel. Once you've found those reactions, there might be a sense of puffiness, pressure pain, coldness, or roughness or dryness. Once you've found those reactions, then you want to treat them. Okay, start off with lighting the bamboo. Okay, and then you want to do 2 temperature tests. So just make sure it's not too hot on your palm. If it's comfortable on your palm, then just go to your wrist, which is more sensitive. And then let's start working on these reactions. So you can start off just with a light tapping. Let the skin start to get warm. And then particularly for these pressure pain reactions, we can do rolling. So start off with light rolling. And then you can roll a little bit more firmly. You can even roll along the sacrum. I meant the sternum. And then if there were reactions along the kidney channel, you can treat those. So in particular, if the sacral pain is more on the left on the person, then you want to treat on the opposite side, on the right. If the sacral pain is more on the right, then you want to treat more on the left. And you might find reactions on the midline, slightly lateral, or on the kidney channel directly. And you can press with the lip of the bamboo or roll until you feel that these changes, these reactions have changed. So you can ask your patient if they feel more comfortable when you press. Okay. I think that's all for the presentation. So great. That's all the videos that I'm going to show you, and all the presentation I'm going to show you. So please, by all means, ask questions if you have any, not just about this material, but about the course that we're teaching in France, because we're going to be doing 4 days. Okay, yeah, saw a question. For this example, I'll come to that, Caroline. So in this example, someone wants to know why the sternum and not the neck. Actually, you want to be also up here because this is kind of more or less opposite, but you'll often find reactions here. Everything is not quite symmetrical in this model. It's not like this is exactly the sacrum, but this is very bony here. So it makes more sense that reactions around here trigger reactions in the sacrum. And very often people attend are right in there, relating more to the coccyx. So the higher up you go, the lower down you are affecting. And the lower down you go, the higher up you are affecting. So remember that piece of bamboo, like a stake. So you really want to go by reactions. And a lot of these bony areas reflect each other. So that's a great question. Thank you.
I have just one question, please. Because this sacrum is on the bone, so you choose on bone, right? Yeah. But if I have a pain on the bladder on the right, at the sacrum area on the right, so I have to use the area on the kidney channel on the left.
Yes, it makes sense. So look for reactions along the kidney channel, and sometimes the reactions won't be exactly on the channel. They might be a little bit more medial. So just look for the reactions, because it's the reactions that you really want to press. If you think about a model of the body, like on the back, we have the dumai, and then we have the jiaji points, and then we have the bladder channel. And then on the midline, we have the renmai. On either side of that, we have the kidney channel. But sometimes there are reactions kind of just lateral. And I think those relate to the jiaji points. So you just look for the reactions, and those are the most important, is that you find something alive and reactive. It's not just theory. You have to find a reaction. Yeah. as far as the Moxa is concerned, then DocSave sell Moxa, like the appropriate grade of Moxa, and Caroline can advise you on what kind of Moxa to use. So you don't want to use the very green Chinese Moxa that you use in a Moxa box. So Caroline also sells that Moxa, so that's good to know. You want to use a Japanese medium grade Moxa, which is much finer, and that means that nothing is going to fall out when you're doing these percussive techniques. Nothing will fall out. Okay, so let me tell you a little bit about what we will be learning on the 4 days, because the first day is pulse taking, and the second and third day are what I call Ontake basic course, and the fourth day is for people who've done the basic course and is about Hirata zones. I should say a little bit about my background. Can everyone mute their microphones again, please? Just so there's no background noise. That would be great. I'm, as you know, I've been practicing for a long time, and I started off doing TCM acupuncture, and then after I think around 10 years, I retrained into Japanese acupuncture methods. So for the last 23, 24 years, I've been doing Japanese acupuncture. And one of the styles in which I trained was Toyohari, which is a meridian therapy style, a 5-element style of acupuncture, which originated in Japan. And the Toyohari Association is an association for blind acupuncturists, for blind practitioners. So you can imagine that their palpation skills are very acute, and their pulse taking is very acute. So you would think that they were like really amazing at taking the pulse, and yes, they are. But their system for taking the pulse is very, very simple, and it only involves 3 or possibly 4 pairs of qualities. And these qualities are strong or weak, fast or slow, and deep or floating. So just these 3 pairs. And sometimes we talk about hardness as well. And from these 3 or 4 sets of information, hard or soft, we can gather an awful lot of information about, not just about the person's constitution, but also about how the treatment is going, because these qualities change on a minute-by-minute basis. So because this is used all the time in Toyohari, I came up with a simple way to learn this system outside of Toyohari, so you don't need to be doing Toyohari to profit from it. And it really is just recording the pulse in a certain way, a numerical way. It's like a 5-point numerical scale. And this makes pulse taking much, much simpler. So you don't have to worry about 28 different pulse qualities. You're only really worrying about 4 pairs of pulse qualities. And you can use that to see how your treatment is going. So for example, if you do a technique on a patient and these 4 pulse qualities change, then you know exactly what you've done and whether it's helping or not. So day 1 is basically getting you practiced into the habit of recording the pulse, doing something, and then recording the pulse again. And then doing something and then recording the pulse. So you're just seeing how the pulse changes during the treatment, and also the kind of signs that can happen when the pulse starts to blow up or starts to get soft or collapsed, which is telling you, hey, it's time to stop the treatment. It's time to finish. So it's just a very practical way of reading the pulse. So that's day 1. And on day 2 and day 3, we will continue using that as we learn Ontake. Now, one of the things that I am also is what's called a habit coach. So I've been studying, the last couple of years, I've been studying habit coaching and tiny habits. So I will be using some habit coaching to bring these things and make them practical throughout the day 2 and day 3. So day 2 and day 3, we'll look at how to load Ontake, how to light Ontake, how to extinguish it safely, and then we will look at the many different techniques of applying Ontake. How to, and then we'll also look at palpation, like what kind of tissues want which kind of technique. So that's what we'll be doing on days 2 and 3. And we'll still be practicing our pulse taking as we go along. Ontake can be put into kind of 3 main uses. And the first is as a branch treatment. And today we've talked about using it as a branch treatment. The second is as a root treatment on its own. So sometimes you get patients who you really don't know what to do. You think you take their pulse and they have so many different symptoms and you're not really sure what to do. So there's a tradition within Japanese moxibustion of doing a kind of standard set treatment on everyone, which boosts the immune system. So there's an Ontake version of that we can learn, which is a whole body root treatment where we treat the arms, the legs, the tummy and the back. So that's a very useful thing to do, particularly with difficult patients who have many, many different symptoms. Then you want to just do a short root treatment, which is going to stimulate their healing response. And on day 3, we will look at Ontake for pain relief. So that's one of the things we just looked at today. And we will see how we can use Ontake for the rapid relief of pain using distal models, particularly Dr. Tan's holographic models. Now, finally, on day 4, I'm going to be talking about something which was the topic of my second book, Hirata Zone Therapy. And Hirata Zone Therapy, I haven't prepared a PowerPoint for today or a slide. But Hirata was a Japanese medical doctor who developed what I would say is the first holographic model of the 20th century. But everyone says it's Nogier, but that's because Hirata was essentially unknown in the West. So people start to think that holographic thinking came from ear acupuncture, which was developed in the 1960s. But actually, Hirata had already developed holographic models of the body in the 1930s, but just no one knew about them except in Japan. And he used what he called a hot needle. And this hot needle stimulated the skin on these zones. And my teacher, Stephen Birch, who had studied with Dr. Manaka, when he heard that I was using Ontake, he said, "Oran, why don't you research how to modernize Hirata zones using Ontake instead of his very unsafe and unfriendly hot needle device." So that's what I spent a few years doing. And the book is the result of that research. And day 4 will be a way to show you how to use Ontake with the Hirata zones instead of the hot needle. And the beauty of Hirata zone therapy is that you can give or sell Ontake to your patient and get them to treat themselves at home very, very safely. So that means that you can accelerate the healing. They can treat themselves daily whilst you're treating them weekly. So that means much better coordination between you and home treatment. It's really great to show patients how to treat themselves at home, and it can be done very simply. So that will be the subject of day 4, is basically using Hirata zones, introducing you to them, and how you can help your patients to help themselves. So that's day 1, 2, 3, and 4.
Sounds great.
Est-ce qu'il y a des gens qui ont des questions? See how European I am? Okay, is it useful to have read my book? Yes. If you can read the book in English, that would be great. It will help you a lot. But I have a confession to make. Many years ago, I think I just qualified in 1987, and I went to a bookshop, I think it was 1988, and I saw Dr Manaka's book, Chasing the Dragon's Tail. And I picked it up, and it was a big, thick book, and I looked at it, and it had all these graphs and all these mathematical formulae, and I thought, oh, that's too difficult, and I put it back. It was only after I studied with Stephen Birch, and he explained things, that he gave me the key to reading the book. And then I read it, and I thought it was a fantastic book. So I don't blame you if you don't read the book before the course, but I think it will be very helpful if you do. But certainly after the course, it will be fun for you to read it. It will make much more sense. I understand that you're an osteopath and that you don't have a lot of knowledge of the meridian system. I think it's going to be very useful for you to know the pathway of each meridian. But you don't need to know any acupuncture points. I might mention points from time to time, but it's not really important, because the unique thing about Ontake, okay, when you do needling, you always needle points, right? And when you do moxibustion, if you do moxibustion on the end of the needle, then you're still thinking about points. Or if you do cone moxa, like Japanese moxa, you're thinking about acupuncture points. But Ontake actually uses lines, or it uses regions. So, you know, like we were talking about today, we were going up and down the sternum, or we were going up and down the sacrum. So the beauty of Ontake is that it uses broad areas to treat areas, or it uses lines, like the meridian lines, to treat areas, you know, to treat the whole body. So if you can learn your meridian pathways before the course, that would be really useful. And if you have some knowledge of how the meridians pair with each other, for example, the lung meridian is paired with the large intestine meridian, then that would be useful too. Good question. It's funny because for me, Caroline and I have been talking about this course for a year and a half, maybe more than that, but the pandemic has got in the way. So it's really great. This is my first teaching outside of Asia for a long time. Yeah, so looking forward to it.
Okay, good. Thank you very much. Bye.
Yeah. Thank you all very much for attending. Yeah, thank you very much.
Merci beaucoup. Merci beaucoup.
Au revoir.